Hello and welcome. My name is Sonia, and I'm going to talk about the CYP2D6 enzyme. So, enzyme activity is the transformation of one molecule into another, namely a substrate into a product. What is CYP2D6 enzyme and why is it important? So, cytochrome P450 2D6 is the critical pharmacogene which metabolizes about 20% of frequently used medications across a variety of medical disciplines, such as psychiatry, cardiovascular, primary care, and cancer treatments. So CY2PD6 has a variety of genetic variations with single nucleotide polymorphism or small insertion and deletions in large structures. The incidence of these variants fluctuate across the population. CY2D6 gene is located on the long arm of chromosome 22, and it's important because it affects the effectiveness and safety of many medications, such as cancer drugs and cardiac drugs and psychiatric drugs. This is a Venn diagram depicting all the various medication classes that this enzyme metabolizes. Okay, some substrates and inhibitors of this enzyme. So substrates. If a tricyclic antidepressant is given in conjunction with an agent that is an inhibitor of this enzyme, this will trigger the levels of the tricyclic antidepressant to increase to toxic levels. So it's important to avoid giving TCAs such as desipramine and other medications like atomoxetine and nortriptyline to decrease the incidence of serotonin syndrome. And also monitor blood serum levels of TCAs or decrease the dose of the medication when patient is also taking an inhibitor of this enzyme. So inhibitors of CYP2D6 enzyme work by increasing the concentration and affects the CYP2D6 substrates. So examples include paroxetine, fluoxetine, Benadryl, quinidine, duloxetine, etc. And when CY2PD6 inhibitors are given concurrently with opioids, such as hydrocodone, tramadol, codeine, oxycodone, that rely on activation of the cytochrome P450 2D6 enzyme, it can drastically decrease the action of the enzyme, leading to decreased generation of the active metabolites, worsening pain control. This is a 3D structure view of the enzyme CYP2D6. And according to Ververs et al., they had a study to show the effect of chromosome P450 2D6 genome on maternal paroxetine plasma concentration during pregnancy. So they realized that there was a reduced plasma concentration of paroxetine in ultra metabolizers of the enzyme, which means CYP2D6 was induced during pregnancy. And then there was a buildup of paroxetine levels in women with impaired CYP2D6 metabolism, which could be due to competition with an endogenous substrate. So ultimately, ultra metabolizers of this enzyme saw more depressive symptoms and during the course of their pregnancy, while the poor metabolizer groups did not see any change. So knowing whether a patient on paroxetine is an ultra metabolizer or poor metabolizer of the drug is important during pregnancy. And these are my references. All right, thank you.